Hello, I'm Sophie Renton. I'm from the Vascular Society of Great Britain and Ireland, and I'm delighted to have Michel Makaroun on my left-hand side, who from the SBS, and Armando Mansilha from UEMS. And we're going to talk about some of the challenges to recruitment, since that's been the discussion today. So I'm going to start with you, and actually, what do you think are the main challenges that you're facing currently for recruitment?
Some of the biggest challenges revolve around the mechanisms by which we train vascular surgeons in the U.S. We have two main pathways to produce vascular surgeons. One of them depends heavily on getting general surgeons who are finishing their general surgery residency to get interested in vascular surgery. But as vascular surgery has changed dramatically over the last 20 years, the type of skills and procedures that we do are becoming vastly different than what the general surgeons are used to or may be interested in. So we're facing less and less interest from the general surgery graduates into going into vascular surgery. Plus the numbers of residency positions for general surgery residents is quite fixed. And the competition for the type of fellowships that the general surgery residents will pick is quite keen between pancreatic biliary, transplant, breast, endocrine, pediatric, a variety of specialties. So we attract about 10% of the general surgery residents, and we are limited in how many we can attract in addition to this. The rotations also on the vascular service from the general surgery residents is becoming more and more limited. So they're getting less exposed to it. So that is a problem because 2/3 of our graduates come from this mechanism. The other mechanism relies on medical students entering the specialty directly after medical school. And that's actually quite popular. And we certainly have a bigger target pool that we can draw from. But unfortunately, the development of those programs has some roadblocks. One is financial, because the hospital typically has to assume additional financial responsibility to pay for at least the 5 years to graduate one person. Then the number of faculty that you require to open one of those programs by the rules of our accrediting bodies has to be one faculty more than the number of residents you have in the program. So you need a faculty of at least 6 to train
5 years
one graduate per year over 5 years. So there are roadblocks in this area.
So are you currently meeting the demand for trained specialists?
The number of vascular surgeons we produce is woefully inadequate right now. We have about 42% of our workforce over the age of 55. And that's because of the way the specialty developed back in the 80s. There was a large number of people that entered the specialty as one bolus. Then when the fellowships developed, they developed very slowly. So we have not been able to keep up with the attrition of our specialists. And there's a tendency, because of the demands of the specialty, there's a tendency for many to be retiring earlier than the usual age of 65. So we are barely producing the number that are retiring. Maybe we're adding about between 20 and 50 a year, and we estimate that we need to add about 150 to 200 a year.
And I'm interested in your recruitment from the medical schools. How do you get the message out there? Because we find in the UK it's a small specialty, so quite a lot of our medical students will not have actually been exposed to vascular surgery. They may not get much in the way of surgical exposure during their medical school training. So how do you recruit them?
So we have the same problem actually. Most medical schools do not include any specific rotations on vascular surgery. So we have to depend on mentorship, on actually going out to the first and second year medical students and giving them lectures. We started some programs of electives by which they can spend 2 weeks or sometimes just 1 hour per week over a period of 6 weeks, where we expose them to what we do in the OR, what we do in the clinics. I find it actually that the generation that is going through medical school right now tends to be very interested in vascular surgery compared to other specialties because of the longitudinal nature of our specialty, where we actually follow our patients, at least in the US, almost for life. And they do like that typical non-episodic nature of vascular surgery. They also tend to like the variety. Many of the medical students that dislike surgical specialties, they dislike the repetitive nature of some of the surgical specialties. They tend to like what we do in vascular surgery. The problem is to expose them.
Exactly.
So we have to go to the deans of the medical schools and try to the curriculum committees, try to make sure that there's a mechanism to expose them to what we have.
So the European perspective, is it matched by that? Do you find similar sort of constraints as the American experience?
My perspective here is a little bit different concerning that on behalf of UMS, the European Union of Medical Specialists, we are more related with all those that already finished university and want to start the training in vascular surgery, and how to define the European standards for training, accreditation and qualification in the vascular surgery. And we don't have now. We don't have that for now. And we had the opportunity this afternoon during this session to present the document that was approved just 2 days ago with the participation of all the European countries that are at the Council of the Section and Board of Vascular Surgery, concerning the contents to define the training requirements in vascular surgery. And this is crucial for us, even for this recruitment, for all those that want or not to come to our specialty. And in this document, we have 3 different things, 3 different chapters related not only for trainees, but also for trainers and for training institutions.
So yours is more about setting standards in terms of the education.
And having that, in my view, will improve also for all those that want to come to know in advance what they have to do, what they can expect from the specialty.
I was interested in your talk earlier. You said that a large number of the people that are taking the UMS exam, and therefore a quality standard, have already got a CCT?
All the candidates to sit the exam must have the CCST, the Certificates of Completion of Surgical Training in Vascular Surgery or in general surgery in those countries that the vascular surgery it is still not an independent specialty. So all of them must have this, or they must have this document in 6 months. We do not accept just trainees. No. So the huge majority of the more than 90% of all the candidates already have this CCSC. They are specialists, recognized specialists in their own countries.
So just tell me, what are the next steps?
Well, for us in the US, we have established a task force to try and figure out if there's another pool of potential trainees that will fit within our model, that will train the type of surgeon that will actually locate in the community hospitals and be able to provide the vascular surgery care that we believe is necessary in most hospitals anywhere, which is still it's not complete, but I think it's gaining traction, and we are putting the final touches on what we suggest will be that kind of training mechanism. But I'm hoping that it will add to the vascular workforce from a different pool of people who can actually become and deliver the care that we want.
Interesting. next steps for you?
We believe that we need to have documents approved by all of us, European countries, to clearly define the European standards in vascular surgery for training, accreditation and qualification. And for this, we need to define the training requirements for trainees, trainers and training institutions, to define a core curriculum and to establish the European exam as the standard through Europe.
Thank you. Thank you very much. Thank you. Thank you both.
Thank you. My pleasure. Thank you.